Okay. Well, good evening, everyone. It's 6:30, and let's get started. My name is Chris Tarabasi. I'm the Chief Executive for Medical Health Associates of Western New York, and I'd like to welcome you to this webinar on breastfeeding basics. Before we get started, there's a couple of housekeeping items to review. The presentation is scheduled to last about 30 minutes, and we'll have time for questions at the end. I'll be monitoring the chat window as we go along, so feel free to drop a message or question there if you'd like. Also, the webinar will be recorded and available on our YouTube channel tomorrow. The link is here, and it also will be available on the PDF, which will be available to you by the end of the presentation. And so without further ado, I'd like to introduce our speakers, Dr. Kara Allaire and Bernadette McLeod from our Western New York Pediatric Office. And with that, I'd like to introduce Dr. Allaire to get started. Thank you.
Hi, everyone. I'm Dr. Kara Allaire. The first thing I wanted to talk about tonight, when we talk about breastfeeding, a lot of times, especially in pediatrics, we focus on the benefits that there are for the baby, which certainly there are. But another thing that's important to look at is that there's also a lot of benefits for mothers as well who breastfeed. So breastfeeding has been shown to lower the rate of breast and ovarian cancer in mothers who breastfeed. It's also been shown to reduce the risk of postpartum depression, and it can help with bonding between mom and baby as well. Also for the moms, it helps promote overall health. Some ways that it does this, so breastfeeding can help with burning up to 500 calories a day and mobilizing fat stores. It also helps with the release of oxytocin, which is a hormone that helps the uterus contract and can help it return to its normal size more quickly after delivery. For the baby, we know that there's a lot of benefits. It's rich in nutrients and a natural source of food for them. That also breast milk contains antibodies, and those antibodies are important because they can help fight infections for newborns. So babies who are breastfed, there's been studies that have shown that there's lower rates of ear infections and respiratory infections, and can also actually be a protective factor for allergy development. Breastfeeding can also reduce the risk of SIDS, or sudden infant death syndrome, and has also been shown to allow for better sleep for both mom and baby. The American Academy of Pediatrics recommends breastfeeding exclusively for the first 6 months of life, and then inclusively, so with breastfeeding and other foods for 6 months up to a year, and then beyond as long as mom and baby continue to desire to do it.
Hi, I'm Bernadette McLeod. So this slide, we're going to look at the breast milk composition, and on the left side we're going to see the nutritional benefits, and on the right side we're going to see the protective benefits of what breast milk has to offer. So have you ever heard the saying that my superpower is breastfeeding? So this saying always reminds me of how beneficial breastfeeding really truly is. So let's take a look at these superpowers. So on the right hand side, it says breast milk has vitamins and minerals. The next one is called human milk oligosaccharides. These are really superpowers. So what do these do? These help to prevent viruses and bacteria from adhering to the mouth, into the stomach, into the intestines. So that provides a lot of protective ability from breast milk. It also lowers the pH of the intestine, and that helps stop the growth of bad bacteria. Then we have other immune cells. So these are live living cells that help to prevent infection. And just a little point that there's actually live cells in breast milk is really amazing. This is a part where with formula, because of how it's produced, there wouldn't be able to have live cells in formula because of how it's manufactured. And then you have some hormones in there. And those hormones help cells to grow, which is what makes babies to grow. And it helps babies to feel more satisfied when they're at the breast, and helps them to self-regulate their feedings at the breast. So that's beneficial as well. So isn't that amazing when we look at just the right-hand side of this slide? So the next, we're going to look at the left-hand side, which doesn't seem as exciting, but that is the nutritional part of it. So you have water, and you have protein, and you have your carbohydrates, which in breast milk is lactose. And then you have some various fats and some antibodies. So next we're going to break down that nutrient part of breast milk. And this slide goes to show for about 4 weeks what the nutritional breakdown of breast milk looks like. So it's very high in water content. So 87% is water, 7% is lactose, which is your carbohydrate. Then you have 4% in the form of fat and 1% in the form of protein. So I use this slide to sort of show that there's different blends of breast milk depending on humans versus other mammals who make breast milk also. So because there's such a high water content with breast milk, babies are eating frequently, and that's why they breastfeed frequently. And they need to be close to their moms so that they can breastfeed frequently. When you compare the breakdown of breast milk to other mammals who also breastfeed, there can be mammals that, for example, live in nests and they leave their babies almost all day to go out and to hunt. And that breast milk blend is going to be very different. It's going to be a much higher content of fat in it. But that allows that mammal to leave the nest to go and eat, and then they come back and those babies are fine for longer periods of time. But when you find yourself frequently feeding your baby, it's because of this breakdown of that there's a fair amount of water in there. So hang in there with that, because that's a big part of why babies feed frequently. So this slide brings the two slides together. So we have the nutritional blend, which is perfect for humans. And then we have all those superpowers on the other side. And that's why breastfed babies have less allergies, eczema, asthma, fewer childhood cancers, less respiratory illnesses, and better immunity to infection.
So when it comes to preparing for breastfeeding, I always say, there's nothing that 100% can prepare you ahead of time. It's really one of those things a lot of times you learn as you go, but there are some things that can certainly help. So there are breastfeeding classes, and with COVID, a lot of these ended up going online, and now since are also returning to in-person, and those can be helpful in giving you some tips ahead of time. And then really the biggest thing I think is getting the support that you need from your partner. So letting them know before delivery what your goals are if you do hope to breastfeed, so that you can be on the same page. And because, like Bernadette said, there's so many frequent feedings in those early days, that anything that they can do to help support you can make a big difference. It's also important to talk to your doctor or midwife, I think, before delivery, so that they know what your goals are. This can allow for them to help you with that immediate skin to skin after delivery. So what that means is when the baby comes, having them go directly onto mom's chest, and that again helps promote those hormones and is good at helping get the breastfeeding relationship off to a good start with that golden hour, which again is that hour of just the bonding time between mom and baby. Another thing that's helpful is knowing ahead of time what some feeding cues are for the baby. So in the first few days, we expect the babies to feed around 8 to 12 times in 24 hours. So again, that does seem like a lot. So any support that you can get. And then looking for even subtle cues. So sometimes this is just little eye movements that the baby will make, bringing their hands up to their mouth, making little lip movements. Those are kind of the early feeding cues. And if you can get the baby to latch with those early signs, it's usually easier. A lot of times once the baby is crying, that's a later feeding sign, so it can be more difficult. So kind of recognizing things and knowing what to do and how to get support for it, that can all be helpful to getting you off to a good start. We do recognize that there are some barriers to breastfeeding, and we hope that we can give you some good tips on how to overcome them. One of the biggest thing to realize is those first few weeks, again, really are the toughest most of the time. So again, if you can get through those, then a lot of times it gets easier and becomes a wonderful relationship between you and the baby. So getting help right away. Most of our area hospitals have lactation consultants that work right in the hospital. So I always recommend that moms ask for them to come and see them while you're still in the hospital so that they can give you some tips and see how you're doing with the feeding before you go home. And then the transition home from the hospital, this is also a big period of time. So usually a lot of times the mom's milk will come in, they say at day 3 to 4. So that's usually around the time that you're going home. So just some things that can help you so that you feel more confident when you do go home. A lot of times new moms will worry about their milk supply and how they can tell if their baby is getting enough. And that can be difficult, obviously, with breastfeeding because we don't know 100% how much they're getting. But there are certain things that you can look for that can give us a good idea. So checking for wet diapers with every feeding. And then usually we say as far as poop diapers that they should be having 4 by the 4th day of life. That's a good sign that they're getting a good amount of nutrition. And then in our office and other places locally, we'll check for their weight. So looking at their weight and seeing that if they're growing, then we know that they're getting the nutrition that they need for their growth, which is a good sign that you have a good supply and there's enough. Another barrier is obviously sometimes for new moms, breastfeeding can be uncomfortable and painful. And while there's a certain level of this that can be normal with the adjustment period, it shouldn't be extremely painful. Moms shouldn't have really bad cracking or bleeding of their nipples. A lot of times when that happens, it's related to the latch for the baby. So we would recommend that you do reach out and get some help. And we would recommend that in our office that you come in so that we can assess things and see how it's going to hopefully help you out and make things more comfortable for you and for the baby.
So the first 2 weeks of breastfeeding, keep in mind the first 2 weeks will be a learning experience for both mom and baby. You'll get better each day and you'll bond with your baby each time you feed them. When I do lactation consults the first time, I find that most parents are pretty overwhelmed. They've gotten a lot of information from nurses in the hospital, physicians in the hospital, their parents, their friends, and they're pretty overwhelmed and just want to do what's right when they come in. This is pretty normal. And sometimes I find that moms will tell me, somebody said they should be on a schedule and everything should be just going great. And I often say to them, no, a lot of times you just feel unsettled during this time, but it all does even itself out and it all does get better. So hang in there with it because you've started a new journey with your baby. And some things will work that some people have told you and other things won't. But that's why we try different things to find the things that do work best for you and your baby. So important to know that in the first 2 weeks, like we discussed before, that they're going to feed pretty much every hour or 2. And that to look at the total number of times in a day also. Sometimes babies will cluster feed, meaning they'll feed every hour on the hour for 3 or 4 hours in a row. So that can add up in your overall count of 8 to 12 times in a day also. So lots of times they'll send you home from the hospital with charts. So those are really nice to use. A lot of moms use apps now. I love those apps on their phones. Helps to keep track. And then when they come in and we sit down and have a visit, we're able to march out how many times they're feeding and how many wet and poopy diapers that we're seeing. That frequency with breastfeeding helps that milk to come in. So I often say to moms, your babies have worked so hard when you're in the hospital with that frequency and feeding. And then by the time you come to us, a lot of times the milk is in or starting to come in. And so what we'll often see in that scenario is the veins will sort of pop out on the surface of the breasts. And that's a good sign that the milk is coming in. So I'll often point that out to moms that it looks like the milk is coming in. And you often will feel fuller when that happens. So sometimes babies are sleepy during this period. And so some moms will say, oh, I thought they were just a good baby. All babies are good babies. So it's important to wake them every 2 hours if they're very sleepy, because we do want to try to get those 8 to 12 feeds in a 24-hour period. So it is okay in the early period to wake the baby frequently and put them to the breast to get them to get the milk production up and running and to get them fed. So looking for feeding cues like rooting, babies rooting around, smacking their lips and mouthing, opening their mouth really big, and put the baby to the breast when you note these signs. Also keeping charts and noting how many wet diapers, 6 to 8 wet diapers a day, and then 3 to 4 yellow and seedy stools. Usually takes babies about 2 weeks to get back to their birth weight. So when you come in for that first lactation visit, you're often not back to birth weight. And that's something that we talk about at those visits and make decisions about whether you come back or whether your weight is in a stable range that maybe you don't have to come back till your 1 month appointment. So super important to take good care of yourself at this point. Healthy moms have healthy babies, and it's important to engage your support system for help and to have people drop meals off for you and perhaps grocery shop, whatever little things that you need help doing. It's important to engage your support system and ask people for help during this time.
So just continuing to go off of that, getting the support that you need to succeed with breastfeeding is really important. So it's been shown that moms who do get help are more likely to continue with breastfeeding. So that's one thing that we always encourage you to reach out when you do need help. There's support in the hospital. So again, they do have lactation consultants that can help you right away in the hospital. And then when you're sent home, in our office, Bernadette and myself offer lactation visits, both at the newborn visit and then beyond for any follow-up that's needed. In the community, there's other lactation consultants as well who can be wonderful and very helpful in giving you more support outside of the hospital. Then there's also something called baby cafes, and those are held at local hospitals and some OBGYN offices where you can bring your baby, and there's usually a lactation consultant and some other mothers and their babies, and you can talk about any issues that you're having and get some other support from the moms and the lactation consultants there. And then there's also the La Leche League. There's our local chapters of this, and if you look on their website or Facebook page, there's a lot of information and a lot of different tips that are helpful with breastfeeding as well.
Foods to avoid. So this is a frequently asked question, and many of you may not be aware that during your whole pregnancy, the foods that you're eating, your baby actually tastes that through your amniotic fluid. So a lot of moms will come in and they'll say, what foods should I avoid? Unless you're really seeing a consistent pattern with a certain food where the baby might be a little bit upset, or you just have a really rocky night with the baby, I really don't put food limitations on at all, because generally your baby's very accustomed to the foods you've been eating the whole 9 months that you've been pregnant. So to make giant changes, unless we really can identify that there's a problem, we really don't need to. Medication and breastfeeding. This is another frequently asked question. So always a good idea to call us, because sometimes there's well-intentioned people that give advice about medications, and then moms will call here, and then we'll look things up for you to make sure that it's safe for you to breastfeed while taking medications. I'm often amazed how many medications can be taken. There's very few medications that we have to put limitations with. So always feel free to call us. We're happy to get back to you pretty quickly within the day to give you information if you just want to run it by us, or if you are wondering, you know, if maybe there was some misinformation and you want to get it double checked.
So another thing that is commonly brought up these days, and a lot of questions we get is about breastfeeding during the COVID-19 pandemic. So the World Health Organization, the American Academy of Obstetrics and Gynecology, the Academy of Pediatrics all have different statements on this, but basically they all come down to a similar idea that it is the mother or the family's choice to continue to breastfeed when the mom is COVID positive. We do recommend that if the mom tests positive that she continue to breastfeed, but can wear a mask, and then good hand hygiene. So in general, the things that are recommended to help prevent the spread of the virus. There is the benefit that it's been shown that mom is able to pass antibodies through breastfeeding this way. Another thing that comes up is with COVID, there's been shorter hospital stays. So again, that goes back to just reaching out when you do need help if you're not able to get the support that you need in the hospital to help with the breastfeeding afterwards. When it comes to vaccination for COVID-19 and breastfeeding, again, most of these organizations have statements on it, but time has kind of gone on with it and they've done more studies. Overall, there is support for this for vaccination for moms who are breastfeeding, and we generally do not recommend that if you do get the vaccine while you're breastfeeding, there's no need to discontinue breastfeeding or pump and dump for any amount of time afterwards. And there's also been a recent study from the University of Rochester that came out that showed moms who receive the vaccine and are breastfeeding, there can be antibodies in their breast milk after they're vaccinated as well, which is pretty cool and something to think about when it comes to that as well. So I think that's all that we have today. I'm going to turn it back over to you, Chris, and for any questions.
Thank you very much, Bernadette, Dr. Allaire, for that nice presentation. Once again, if you have any questions or want to make a comment in the chat, feel free to do that. I'm not seeing any at the moment, but we'll just give it another minute. Okay, well, I'm not seeing any. So thank you, everybody, for participating. Thank you, Bernadette. Thank you, Dr. Allaire, for your time. And we'll sign off for the evening. Thank you, everybody. Have a good night. Bye-bye.